Plan F, it's the simplest plan ever. It's 100% coverage. That's it. No questions asked. You walk into that doctor and you walk out, you don't ever get a bill. It's awesome. Plan G is pretty similar to F. It's kind of like F's twin sister. Plan G has 100% coverage after you've met Medicare Part B's doctor's office deductible of $166. Once you've met that, you've got full coverage. And Plan N is Plan G, but with copays. So you'd have a $20 doctor's office visit at the most, and then if you went to the emergency room, it would be $50.
Well, the biggest misconception about the annual enrollment period is that it's October 15th through December the 7th, being the only time you could change or switch your Medicare supplement plan or Medigap plan. When in actuality, you can change or switch your Medicare supplement plan at any point in time during the year.
So as far as the annual enrollment period, a lot of Medicare beneficiaries think that's the only time you can change anything related to Medicare. However, that's for Medicare Advantage plans, as well as your Part D for your prescriptions. Those are year-to-year type of coverages, so benefits are subject to change, and they usually do every year. So the annual enrollment period, you shop your options for the next year.
With the Medicare supplement underwriting process, there are no physicals, no exams, anything like that. Instead, it's just a simple questionnaire on an application that can be done right over the phone. No physical exams. The insurance company will take a look at your past prescription history and your health history to verify that there are no current treatments.
So the great thing about what we do and what makes us different is that we are licensed with so many carriers. So for example, if you don't qualify medically with one carrier, if you can't pass their health underwriting process, it's not that big of a deal. We can take a look at other carriers and apply you elsewhere because every single company has different standards for health underwriting. So just because you don't qualify with one company doesn't rule you out for all companies. You're free to try other options.
An important step of Medicare is making sure you get that drug plan. It's called Medicare Part D. Medicare Part D is going to behave kind of like any other drug plan you've had, where as we grow and change, medications are added or dropped from our daily needs, and that drug plan is going to be there to help support the cost of those, so you're not paying full cost for those expensive medications.
Whenever you are first selecting your Medicare, you'll want to go ahead and shop your options for your drug plan then, no matter what time of year it is. But also keep in mind when the annual enrollment period comes around, October 15th through December 7th, you need to compare your drug plan again, even if your plan went into effect in October, because you're shopping for the next year. There will be changes made. You don't want to be left disappointed. So you would absolutely want to shop your drug plan option during that time, and then the new plan would go into effect the following January. Part D, it's based on the medications you take as well as the pharmacy you use as to what's going to be the best plan for you to go with. Medicare beneficiaries, for the most part, they're retired, they are on a fixed income, so they need to know exactly what their out-of-pocket expenses are going to be. So I always encourage clients to go through the prescription drug plan finder located on Medicare.gov. You enter your medication, select the dosage, the frequency. You can even compare up to 2 pharmacies. Medicare does all of the work for you right there on the website. So they will automatically sort your results by your lowest total out-of-pocket expense for the year.